And so we move on to our next segment with our very own Vandana Yadav, Senior Associate Consultant and Research and Strategy Consultant at HITLAB. Vandana, are you there?
Yes. Hi, Jerry. Hi, everyone.
Hi, Vandana. Thanks for joining us. Those of you that don't know, Vandana is actually dialing in from India. Really appreciate you coming on, Vandana, especially at this late hour on the other side of the world.
My pleasure. Absolutely.
So I'd love to get the audience to know you a little bit more, Vandana. If you give us a 60-second background on yourself and the work that you're doing currently at HITLAB.
Sure. So by background, I have engineering in biotechnology. I did it from University of Delhi. Thereafter, I did my master's in biomedical sciences from University of Edinburgh. I've been working for HITLAB for now over 3 years, and my role is at its core to support research and strategy activities at the lab. I am really committed and very passionate to support ideation, creation, and specifically evaluation of digital health technologies across the lab, and really excited to work with so many different sponsors, partners from pharma, medtech, and academic institutions, and a lot more.
No, wonderful. And really great to have you as part of the team, of course, Vandana. Really essential part of the HITLAB team. So I think this session, what we'd really like to get to understand is how HITLAB has really been instrumental, within the ecosystem, and the work that you do with the lab in terms of increasing health tech adoption with the various different organizations that we're able to work with. So if you could just kind of go into a little bit more detail about, existing approaches for evaluating like digital health solutions and how that impacts adoption.
Sure. So there are 3 to 4 broad categories of existing approaches for evaluating digital health technologies. And if we start mapping them in increasing order of evidence strength, as well as the duration the studies take, we should begin with something called expert opinion or case example. When the startup or the company is at very initial stage of product development, they will go to an expert, ask for an opinion in terms of how does the idea, the concept, or the initial prototype looks like, and solicit that feedback and incorporate that going forward in the product development. Going further to the next category, which takes a little more time, which is more sophisticated in terms of the evidence quality and strength as well, are the surveys and questionnaires or interviews, which we usually do to establish products' usability, feasibility, and efficacy. They are low-cost approaches, very efficient, very scalable tools, and they help in collecting user attitudes, knowing about user experience and suitability insights. And there are a couple of methods we use there, from usability questionnaires to user-centric design to net promoter score surveys or online surveys, or just simply log file data analysis to see how users are interacting with various digital health solutions. And these studies around visibility, they not only minimize development time and production cost, but they also uncover useful insights to understand the mental model of users and to understand their ambition, their goals, their pain points, and then leverage it and use it for increasing adoption. And then the next category we have are the retrospective studies. Now, we are all aware, as the term suggests, these are done to analyze pre-existing data like patient charts, EMRs. So you're not really collecting anything in real time. So it's quicker, it's cheaper and easier as compared to RCTs or prospective studies. But of course, there are limitations. They're considered inferior to RCTs for obvious reasons, like they are subject to bias or confounding factors, like what if a patient information loss had happened at any point, or there were some risk factors but they were not recorded, and things like that. So they are used, but really to generate hypotheses for further investigation by prospective studies, not as standalone, very reliable evidence generation tools. And then finally, the main star and the most widely recognized and accepted are the prospective randomized clinical trials. While they are very well accepted across the ecosystem for all types of healthcare interventions, we have seen not a large number of digital health tools specifically go under randomized clinical trials. And this may be because they have become less practicable with time. And by that, I mean now the rapid scale with which digital health products are produced, the speed of production and the iterative upgrading that happens, it just makes these high investment, high time investment and cost investment clinical trials little less practicable. But nonetheless, these are the ones currently that are traditional approaches and are very well accepted across the ecosystem. And then, of course, there is economic evaluation. You have to demonstrate positive economic benefits, and it's critical for a majority of end users to really justify adoption decisions. And not just end users, in fact, the payers or other stakeholders who are associated with product adoption. And actually, WHO has given very clear guidelines on various options of evaluating, like cost effectiveness analysis or cost benefit analysis. And there are other methodologies that you can look up. They're clearly available. So yeah, these are few 3 to 4 categories of existing approaches for evaluating digital health technologies.
No, really, really wonderful information to share, I think, with the audience, and really taking a look at those different approaches. I know we don't have much time left, if any, Vandana, but I'd love to just get a 60-second take on different critical evidence gaps and challenges within traditional approaches right now, from your point of view.
Sure. So as I mentioned, the approaches for evidence generation that come at early stages of product development, they usually deliver weaker evidence, or they do not generate evidence which is widely acceptable by majority of stakeholders. That sort of evidence is generated only by randomized clinical trials or the traditional approaches, as I was saying. So the problem is that there is a gap between these quick, lower cost approaches, which are applied at early stage of development, and the higher cost approaches, which are needed to convince majority of stakeholders. And if you talk about challenges for traditional approach from the perspective of digital health innovators, well, small to medium-sized enterprises, they have limited resources to undertake clinical trials. And if we talk about multinational corporations, they don't have an investment priority for out-of-date evidence. So at early stage, the product keeps upgrading. So they cannot go for and invest in a clinical trial every time an upgrade happens. So that's not their priority, obviously. And academic institutions, they're more focused on research output than widespread adoption. So really, we need some combination and innovation in terms of traditional approaches and new approaches to fill this gap and address these challenges. I know simulation is something which is being explored, but still at very nascent and fragmented stages, I would say. But let's see how the ecosystem evolves, and hopefully we come up with better approaches to evaluate digital technologies as the regulatory framework is also evolving and getting more complicated and more accommodating with time.
Yeah, no, certainly share your sentiments there, Vandana. Thank you very much for your input and your insights on that. And I'm sure you had much more to kind of unpack there, but again, Vandana's information will be in the chat box if you guys want to link up with her over LinkedIn and connect, and again continue that to continue this really important conversation of approaches to health tech adoption and so forth. So thanks, Vandana, for coming on, and wish you a good night since it's very late over there now. So I really appreciate you being on.
Thank you. Thank you.
Wonderful.